right. So, as I mentioned, I'm Sekesa Berry. I'm the founder and the executive director of the Georgia Black Doula Network. And welcome again to Safe Beginnings for newborn care, infant health, warning signs that every parent should know. We're just going to breeze through these slides and, share information. If you have any questions, like I said before, you can either put them in the chat or you can just, come off of mute and ask. Either one is perfectly fine. All right. So feel free to answer again these questions in the chat if you like. But this is just a simple little quiz. True or false? All newborn babies cry when they're hungry. You think that one is true or false? A lot of parents, um, honestly don't really know, right? But I think this answer is kind of ambiguous. It could be either true or false. Let's see what we get here. Yeah, false. I like that. Yeah, I think sometimes this can be considered a little ambiguous as well because ultimately they're going to wake up. A newborn baby wakes up when they're hungry. That's one of the first signs, in my opinion, that I've witnessed not only with my own children, but just as a midwife. Failed to mention that earlier. I am a community midwife and a doula. I've done doula work for about 10 years prior to becoming a midwife, pushing on 10 years for midwifery as well. So, yeah, in my experience, they first thing they do is wake up. Crying is one of the last signs of hunger for babies. Um, Newborn babies cry because they are spoiled. I think we pretty much know the answer to that one. And that one would be false as well, right? Newborn babies are not spoiled. Their brains aren't big enough to be spoiled. Their little brains operate primally, right? Their neocortex, their frontal lobes are not fully developed. So they don't even know what it means to be spoiled. They're just operating on their primal instincts. And so they cry because something is wrong, whether they're hot or cold or, tired or hungry can be when they've gotten to that, last stage of hunger. All right, newborn babies need a pacifier when they cry. True or false there? I know that one can be a little tricky. False, absolutely. Newborn babies, no, I actually do discourage using pacifiers for newborn babies, especially in those first couple of weeks. You want to understand the different types of cry. You want to really get to know this person. And every time we put a pacifier in the baby's mouth, it's like telling them to shut up. So we don't want to do that. We want to, understand, relate, communicate with this little person and hold off on the pacifier for a while. So true or false, you should ignore your newborn baby when they cry, right? I'm pretty much sure we understand. We know that's a universal no. Exactly. We understand that that is not what we want to do. We do not want to ignore this little person. We want to give them the attention they need, similar to, like I said, with the pacifier. So, fun little test or quiz to get us in the mode of learning more about how to handle our newborn babies. So yeah, it's not surprising newborns are incredibly fragile and need to be handled with care. Just, this is pretty, you would think it was universal, but I have certainly had a couple of families in my career that never encountered newborns. And so, they're very anxious about how to handle this little person. And so, just some simple things, unless you're the parent, you definitely want to wash your hands before holding them. I would say mothers specifically, we share a microbiome with our newborns. And so we really help them to actually not only the mother, the father as well, we help them to produce that microbiome all over their bodies. So you don't have to be so rigorous about washing your hands every time you pick up your baby, right? Let's use best practices. If you've been, handling the trash or doing something with a pet, of course you want to wash your hands. You've been outside, if it's a dad, dealing with a car or I don't know, something when your hands are dirty, we definitely want to wash them. But ultimately, all that hugging, snuggling, and kissing for parents to babies are very much needed. We don't want to shake a baby. I think we know that nowadays, there's enough information out there. We talk about the damage that can be done to this little person if we were to shake them. Um, Cradle their head and their neck, their necks. I will say this as well. Newborn babies now, their necks are much stronger than mine was when I was born, right? So, but still, we want to handle them with care. We are evolving. Our bodies are a little bit more stronger now than they were 50, 100 years ago, right? However, they're still their necks are still not as strong as they will be in a month-old baby, for example. So we want to make certain that the scoop technique is what I like to kind of get in there and scoop them up. Right, and that way you're supporting the back of the head and the neck at the same time. And like this dad is doing, kind of cradle holding your baby would be ideal. And holding your baby skin to skin, like I mentioned, that microbiome, it helps them to develop that for both mom and daddy. We don't want outsiders doing it. Tell aunties, cousins, grandma that they need to put a shirt on and even a burp cloth when they hold the baby. But you, as the parent, skin to skin is great for the baby. Okay, how are we going to soothe our newborns? Now, this one we get a lot because little people can be so cranky. Some of them still have what's being identified now as witching hours, right? Or colic. I think what we once assumed was colic is now taking on a greater meaning. It's not always gas and indigestion that's making them cranky. Sometimes it's just growing pains. We understand now that babies actually feel discomfort when their little bones and things are growing. And so sometimes it requires them to be swaddled really tightly, right? Because that compression helps, it feels good to their little aching bones. So there's a variety of reasons why these babies are unconsolable at times, and it can be very taxing on your mental health. Being a mother of four, I can totally be honest about that. But yeah, it's a great opportunity to learn how to swaddle. So the ticks with the S, ticks technique is it's a little dated, but it's still, tried and proven, right? Tight, in view at all times, close enough to kiss, keep chin off the chest, and support it back. What they mean by that is a baby like this, they can either lie face up or you can lay them on their side. We'll talk about that more when we talk about sleeping and co-sleeping with your baby, but I'm very, very much in support of side lying for newborns. But wearing your baby, carrying your baby close to your body with a carrier, I love that. Babies just love touch. They love being held close. Newborns, that's what they know. That's their comfort zone. They've been in utero since conception and in a very tight, confined, warm space, safe space. And that's how they like to feel. They're not a big fan of car seats and all the different baby gear that's out there. Their happiest place is right on top of you, right next to you. And that can also, I understand, can be draining for some people. So it's great when you have support in place. We talked about that a lot in our last week's class, postpartum support. It was postpartum essentials, but we talked about support and different ways your support team can show up for you during that fourth trimester to help hold the baby and give you a break because sometimes we just get touched out. But these little people are just very, very content, right on specifically their moms because they're in tune with your biorhythms. They're in tune with your heartbeat, your breathing rhythms, your voice, your swallowing. These are the things that remind them of their home, which was right in utero. So you have to just kind of be patient with their growth process in that regard. So infant massage is also a really good method for establishing this bond, right? I encourage a YouTube video, maybe looking into it so that you can get a better understanding, um, but just the right amount of pressure and how to follow like the little meridian pathways of the baby's body, but just simple touch. I didn't have any real guidance on how I massaged my little ones. I just knew that they liked it. And so part of our daily routine, especially as they were older, after they have the little bath, was just to get all of them down. And I used to use like a big component of all natural products, especially for newborns because we don't know what they're allergic to just yet. Their skin is very sensitive. So I used olive oils, shea butter, things like that to rub down and oil my babies. But, just pulling on their little arms and give it a nice little stretch, nice little stretch. The same with their legs, giving them a nice little stretch, uh, you know, little soft, gentle massage down their little spines in the back. And they would sleep so good after that type of touch. So moving on, feeding your newborn, breast milk, breast milk, breast milk is always great. We had a class on breastfeeding your baby. And just depending on the website you go to, uh, it's undeniable that breast milk is the best food for your newborn baby. However, I do understand that breastfeeding is sometimes can be challenging. I was a lactation consultant for many years as well. I ran lactation clinic, and I know that families do experience problems when it comes to latching and breastfeeding. And like I mentioned, we have a whole video on that that we've uploaded to YouTube that goes into detail about how to um, breastfeed your baby and some tips and techniques for you as well within that video. So I won't go into that too much, but just understanding that it is a complete food and it helps your baby to build their immune system from the colostrum that your body first produces to the mature milk that you will have through the duration of your breastfeeding experience. It is full of antibiotics, antifungals, antimicrobials. It is just the perfect food. Human milk for human babies, housing ever. Sometimes formula is needed. And so some of the signs to look for in your baby is the smacking of their lips, sucking on their hands. They'll do that. That's typical newborn behavior, just human newborn behavior. The sucking on their hands. They turn their head searching for food. You'll see this activity in newborns upwards of a month, 6 weeks old. They're still doing this same feeding behavior to let you know that they're hungry before they cry. So even with the formula fed babies, as I mentioned too, most newborns, the first sign is they wake up. If they've been asleep, they typically will wake up when they're hungry. After that, you'll see some of these other behaviors in them. And so with formula, I would say the takeaway from here is you mix it according to the directions. Don't add anything to it. That is a very um, bad habit that we have that started with when we made our own formula. My parents' generation, for example, my parents were born in the 40s, and their parents, they were the first generations, the boomers were one of the first generations to be weaned off of, or not introduced to breast milk, right? They typically in that generation, that was during the time when their mothers were going into factories. I forget which war that was. It was a war happening, one of those World Wars II, I think maybe, I don't know. But it was one of those wars that caused the women to have to go into the factories. And so as a result, there was these homemade formulas being made. And most of those formulas consisted of some type of Karo syrup or molasses or powdered milk or pet milk. These were the things that we combined to make a formula for these babies while the moms were away. And as you can imagine, some babies were very ill from that. Some thrived, like my parents. They're still alive, bless their souls. They weren't breastfed. They were given these homemade milks, and this is where we have the idea of adding things to our to the formula, but formulas are already very, very high in calories and sugar. Most newborn baby formulas have about 40% sugar. So when you go and add Karo syrup to it, or even rice powdered cereal or oats powdered cereal, those things, it's just way too many calories, and you're establishing precursors to diabetes for this child, type 2 diabetes. So you really want to be cautious when it comes to adding anything, unless it's recommended by your pediatrician, which most of them do not recommend adding anything to the formula. Let's just not do it. Mix it as directed. And then another takeaway with formula is after 30 minutes, it's done. If after about an hour, it has so much bacteria in it, it's not you really shouldn't be consuming it. Most uh, formula bottles will say that it's good after an hour, after you mix it or after you open it. But truthfully, after 30 minutes, bacteria has started to grow in that, because it doesn't have any live antibiotics to fight it off. So just be mindful. If your baby's spitting up, it's not always GERD. Sometimes it's just old milk that you're giving the baby, and you need to be mindful of mixing it when baby's ready to eat it, and not necessarily pre-mixing it to take on a road trip or just having the bottle ready. Newborn babies are very sensitive to these things because they're still building their not only their microbiome, but their intestinal flora is being built as well. So let me move on, because that's a soapbox for me. Okay. And again, if you have any questions, put them in the chat or just ask me, take yourself off mute and ask the question. All right. Oh, okay. Changing diapers. Well, I will say this about breastfeeding. You got to have a lot of diapers. Breastfed babies poop very, very often, almost every feed. And we anticipate a breastfed baby to feed about 10 to 12 times within 24 hours. So that's a lot of diapers. You do the math on that, right? So we definitely want to change them frequently. As it says here, you can anticipate several soiled and wet diapers daily. Um, the best thing to remember with diapers is sticking to one brand. I wish I had known this with my babies, because it is very true. But all diapers have chemicals, some type of chemicals in it. As a woman, that's menstruating, you understand that you're dealing with pads, right? Because some of them are using the same materials that they put in menstrual pads, the same materials that they put in diapers. So very similar materials. And some women can be sensitive to one brand of pads than they are another, which is one of the reasons why the cotton, what do you call it? The top cover I'm stuttering. A lot of pads now, the top cover is cotton because of this hypersensitivity that is very common nowadays. Well, babies are no different, and they typically will build up a resistance to one brand of diapers. Um, and so you want to try to stick to that, whether that's Pampers or Love's or the store brand. It doesn't even matter. Whatever brand you're using, let's try to tell everybody that's buying diapers for the baby, let's stick to one brand and use those consistently while the baby's wearing diapers. Um, and then you want to use a hypoallergenic wipe if possible. Uh, those are pretty common nowadays. You don't really find any scented wipes too often. They may have a baby powder scent or something like that, but ideally you want it to be just scent-free, hypoallergenic, like the Pure brand. My children, for example, I always say I didn't realize how beneficial the things were I was doing. I call it my poverty parenting days when my babies were really young. And, we, again, poverty parenting was real. So certain things like wipes was a luxury at one point, right? You think they're essential, but they can be somewhat of a luxury. And, unbeknownst to me, I was really doing great by just using, I would carry a Ziploc bag with, I would baby washcloths. So I would have like maybe five baby washcloths in a Ziploc bag, and I would always carry two when we went on an outing, and I would just use those wet washcloths to clean their bottoms, and then put it in the other. I have one Ziploc bag for soiled washcloths, and the other one would be for the clean ones, of course. And then so I would just do that, and as you can imagine, it would limit my time out. But certainly when I was at home, that was routine. And if I had wipes, they were reserved for our outings in most cases. And I use cloth diapers a lot, and mostly because we would just, I would be in the store and it's like, okay, I can buy groceries or I can buy diapers, and groceries are going to win. So, but again, unbeknownst to me, these things were much better for my baby's skin. And I really was doing them a great service by using cloth diapers and the actual washcloths in water as opposed to wipes and diapers. And I was doing it justice to the environment. So, now it's trendy to have they got the whole fancy little cloth diapers, which I really, really love and wish was available when my children were young, but they weren't. But no matter how you choose to diaper your baby, the main thing is being consistent with that type of diaper. Again, and if you're using cloth, you want to be consistent with the type of washing powder, the laundry detergent that you're using. Okay, when it comes to rash
Excuse
creams,
me.
yes,
Hey, I have a question.
yes.
Before we move from diapers, because you mentioned newborns and being breastfed. So my baby is actually a week and 2 days right now. And I've been having issues as far as bowel movements, because you mentioned breastfed babies have frequent bowel movements and mine has not. So do you have any I guess consistencies in that or ideas of what that could be? Because we were discharged from the hospital on Saturday, so that's been just a week. So he did the initial poop, the black tarish kind of poop at the hospital, and then he had maybe two of those, and we've been home since Saturday, and he's only had one other poopy diaper, which was like a dark color, and that's been it. He has went to the pediatrician, and she said, he looks fine, but I know that's a warning and an issue for me because I don't know what kind of else to do as far as to get him to poop, and I just keep breastfeeding as normal, but no poopy diapers.
I understand. As long as it's exclusive breast milk and he is nursing, like you said, it shouldn't be too much of a concern. It's not uncommon for breastfed babies to have a one poop a week. And I know that can be very alarming based on what I've just shared. But again, like I mentioned, I have run clinic before, and that's totally normal. And I want to say all, I would say majority of breastfed babies by 2 months will revert to that one poop a week. It's less common to see it this early, but it's not abnormal. What you can do, as let me put a little disclaimer on that, as long as baby's behavior is non-irritated, like they don't have a fever, he's not experiencing any discomfort to express that there's a digestive issue. So what typically works, and I don't know if you've tried this yet, but you could take a baby thermometer and just push it like 1 centimeter. So that's just like very, very, no more than 2 centimeters into their rectum, just very, very slightly. What you want to do is you're triggering the anal sphincter. And so
Mm,
you just kind of tickle the anus you could do it with a Q-tip as well. That actually might be better than a thermometer,
okay.
actually. Let's do a
Okay.
Q-tip. It's just that
Mhm.
the tip of the thermometer is smaller than most
Right.
Q-tips. So, but the
Okay.
Q-tip will do just the same. If you do either one, you want to make certain that you put a little, Vaseline or some kind of lubricant on it and
Mhm.
gently slide it in there and just gently tickle that sphincter. And sometimes they'll poop immediately. but
Okay.
certainly within that same day, it usually will get them going. Also, if you haven't tried it, just rubbing their abdomen, kind of rubbing it, what is this? Clockwise, around
Okay.
clockwise, gently rubbing it, that stimulates the digestive system as well and kind of follows the pathway of the intestinal tract, that
Hmm.
clockwise motion on the baby. So you could do that and then do the stimulation of the anal sphincter, and you should get some poop that day.
Okay, I'm gonna try it.
Yeah, 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 yeah,
Yeah,
yeah.
that's been the most
Pediatrician actually taught
alarming
me that with
thing.
my first. I went through it,
Okay.
but he was in that 2 month range, and I was freaking out because I was accustomed to this baby going every day, several times a day.
Wow.
And all of a sudden, we weren't pooping at all. And she put
Hmm.
that little thermometer on. She put this, the way this baby's legs are, like you changing the diaper right here. That's how she
Right.
did. She folded them legs up, put a little thermometer in. She used a thermometer,
Hmm.
and baby pooped all over the it all just came out on her table. Yeah.
Mm. Okay.
So,
We'll try it.
and
Thank
I
you.
honestly don't know the science to it. I do not know, um, why they do that.
Hmm.
But we do understand that as long as it's breast milk, it's not a problem.
Okay.
hmm
That's all
We,
he's had since birth.
okay. Yes. So I hope that works out for you.
Thank you.
So yes, so circling back to diaper rash creams, we want to use them sparingly. You could do a good coating of a shea butter, or mine's grew up on Vaseline. I know it has its own pushback now from different TikTokers, but I thought it really worked well. It was a great coating, like a extra barrier from the diapers. I always used it when I used diapers, but what I find that nowadays, families will use a diaper rash cream for every diaper change to use as a barrier, and that's not a good idea because those creams have um, healing properties in there. And so overexposure to it can cause irritation. And so again, if you don't want to use shea butter, I think coconut oil is very popular that people will use. Coconut oil is great. It has an antifungal in it. It'll help to fight off any germs. The only thing about coconut oil is it's highly absorbent, and so it's not a good moisture barrier. So you could marry that to a shea butter and use it that way. And coat that on the baby's bottom to help prevent overexposure to moisture. And then just allowing your baby's bottom to breathe. I know it's a little harder with boys, but I would do with my son as he got older because of the rashes we were experiencing, because I didn't know about not changing the diapers and using whatever diaper was on sale is what I was using. But I would just open it, kind of as you see in this picture, the diaper is open, and just let it cover, because if not, they'll pee on themselves. Like little boys, their little pee will go spraying everywhere. So you just want to kind of cover them with that, or put them on buy some cloth diapers and just use them once a day. Like maybe give the baby bottom breathing time and let them just have that cloth diaper once a day and take a break from the regular diaper, and that give me the baby bottom breathing time. So, um, moving on, bathing our babies. Um, your baby can receive their first bath soon after birth. Now, I will say that, especially again, I'm a community midwife, so I do a lot more home birth, and those families sometimes delay the first bath. And I'm told that families will do it in the hospital nowadays as well. So know that that is an option for you. You can delay the first bath if you like, so that the baby can absorb all of their vernix. That's the coating that was on their skin in utero. And sometimes families just like for their babies to absorb that because it also has certain uh, healing properties and antibiotics and things in it as well. And so, but whenever you do give your baby a bath, you want to be certain that if the cord is already cut and it's been a day or two, that we do not wet the cord again. We want to make certain that the cord has fully healed because it can increase the risk of infection if we repetitively wet the cord after it's been cut. We want it to dry and fall off. And so before that happens, we're just kind of wiping babies down. They don't really get too dirty. Newborn babies are typically just either being fed, held, or laying down. They're not really, in doing sweating. They're not really going outside. They're not really dirty. So you don't have to worry about submerging them in water every day. So just a little sponge bath is nice, getting under the necks, definitely washing their faces, things like that. But the thing to be mindful of when the cord does fall off and you are ready to bathe your baby is making certain that we turn off all fans and any nearby vents because babies do not thermoregulate very well. Newborns don't. And they can easily go into hypothermia, right? And they can easily overheat as well. So the same is true on both sides. So we want to be mindful of how of the temperature of the room when we give the baby a bath. So no cool air should be blowing on them. And so, have all your supplies ready. And then when we start to bathe our babies, we want to wipe from the less soiled areas towards the dirty, right? So the face, go from the face to the feet. And so when we wash in the face, just something to be mindful of with the eyes is to wipe from the inner side of the eye to the outer, and then change the washcloth. You use another side of the washcloth and do the same with the other side. Now, some newborn babies need their tear ducts to be massaged. Some newborn babies, for whatever reason, I like to say activate the tear ducts because sometimes they don't they can get infected because they're clogged or they're blocked. And so just taking a warm washcloth, maybe even putting a little olive oil or something on it, just a small amount, and just massaging the inner eye. Take my glasses off so y'all can kind of see. You're just kind of massaging the inner corner of the eye and wiping outward. And then you switch the washcloth to another clean space on the washcloth and do it again. Wash the inner corner of the eye and wipe outward. And then you do the same thing on the other eye, and that will help to loosen up any clogging within the tear ducts and help the baby to um, cry and avoid any type of eye infections because that is pretty common in newborns. And then that's just best practices throughout the time that you're washing your baby. And so always wash their hair last. After you've bathed their full bodies, ideally you want to wrap them in, as you see in this picture, a blanket. I'm certain you've seen this in the hospital if you had your baby in the hospital, that's their technique. They will wrap the baby in a blanket and then wash their hair. And you want to continue to do that because they lose heat rapidly through their heads. So, best practices for washing and bathing your baby. Okay. Sleeping. Newborn babies sleep most of the day. Is breastfed babies may be awake a little bit more though, if you haven't noticed already. They typically do not sleep throughout the night until they're about 3 months postpartum. People typically often will say, "Oh, my baby has their days and nights confused." That is not true. They do not have them confused. If you remember when you were pregnant, the baby would be awake as soon as you laid down for the night to go to sleep. That's when they typically are up, moving around, swimming, kicking, doing all the things. And that behavior continues for typically for another couple of months after birth. They're wide awake at night and also consider stimulation. Um, there's a lot of stimulants during the day, so many smells and sounds, in the light and the bright lights, a lot of things for babies to process during the day. At night, it's quiet, it's serene. So this it's easier for them to concentrate at night as well. So these are the reasons why you'll see that type of behavior in newborns. It's not that they're confused. It's just that this was their in utero behavior that you're seeing now that they've been born. Okay. Your baby will wake up to eat. We mentioned that several times. So when they wake up, be prepared to feed them, whether you're breastfeeding or bottle feeding, be prepared. Um, Avoiding putting pillows and excess materials in the cribs, right? That's the safe sleep practices. As you see this little person in the picture, they have a blanket tucked behind them. That's typically what you want to do for newborns. The main reason why I am not a fan of back to sleep is because they're more likely to aspirate. Newborn babies will still cough up. They have a very short esophageal pathway. Very, very short. This is why it's so easy for them to hiccup or cough or sneeze and milk comes out of their nose because it's such a short pathway. And it doesn't bother them like it does us. It burns. If we have milk or something come out of our nose, it burns horribly. It does not bother them. And that's because that pathway is so short. Um, and so, because it's so short, they're very likely to spit up. And then, newborn babies, especially boys, in my lactation practice, I saw and learned that their esophageal sphincter can be slow to develop. It can take them a few months. And that's why we see more spit up and GERD and things like that in boys than we do girls, right? So because of this, we want to make certain that we're lying them on their side. If we place them on their back, and they do spit up something in their sleep, they can choke. And that's we want to avoid that. We want to avoid aspiration. So put your newborn babies on their side. And then you could practice, if you want to practice back to sleep, you can do that when they're able to move and rotate a little more, when they can roll themselves from their sides to their backs. Then they have more body control. But a baby that's a few weeks old, side lying is best. Okay. Um, Co-sleeping. I know this is a big no-no for hospitals and those of you that have babies in the hospitals, but babies sleep great. We've been co-sleeping since the beginning of time. And I encourage folks that want to co-sleep. We just teach you how to do it safely, right? So it's the um, same best practices as a baby sleeping on their own. We want them on their side. We want to minimize any extra pillows and cushions and things that's laying around the baby. But one of the sleep labs in I don't know if this was in the US, but I know there was a sleep lab study that was done some years ago when I was running lactation clinic that proved that a non-intoxicated breastfeeding mom will not roll over on her baby. We actually have it's a breastfeeding human behavior is what it was titled. Breastfeeding, sleeping, human behavior, something like that. Breastfed human sleeping behavior. Breastfed human sleeping behavior. That's the title. And what it is, it's kind of like you see this mom in this picture. Typically, they said that we go into a protective laying stance where we have an arm behind our heads. Another one is usually swaddling our babies. And then our legs even, it's kind of like laying in child pose on your side, right? Your legs even are your knees are at least one knee will be bent up, and so that you create this safe space in the middle for your baby. So that's a very common sleeping position. Is human behavior for breastfed mothers to sleep in that way. Again, a non-intoxicated breastfeeding mother. So have no fret. Dads and none or non-breastfeeding parent will roll over on that baby. So they sell co-sleepers now. I'm a big component of those. They have the co-sleepers that go in the middle of your bed, and they have some that attach to the side of your bed. If you want to co-sleep with your baby, you can consider those, especially if your partner is also in the bed with you. So you want to be certain that baby is safe from your partner while you're lying together. Um, but rest assured that you can co-sleep with your baby and do it safely. The benefits of co-sleeping, it encourages more breastfeeding. During that same sleep study that I just mentioned, they noticed that those mothers breastfed, I want to say it was 15%. Those babies breastfed 15% more than babies that were not co-sleeping and slept on their own. Those babies were more likely to wake up to feed more. And one of the things we would encourage for a non-latching baby when I ran clinic is co-sleeping, because sometimes those babies would innately find the breast. We would encourage the mother to rest with the baby and have her breast exposed. And so baby and mom are sleeping, and co-sleeping and resting together. And sometimes baby would find the breast all by themselves while they were resting there, just relying on their primal brain and their innate behavior. They would find the breast by themselves. So co-sleeping is okay. All right. If you're, especially if you're breastfeeding, or not, if you're bottle feeding, still use a co-sleeping device to place in the bed with your baby. And moms get, and the parents get receive more sleep too when we co-sleep. I lived by it. All four of mine. They had my cribs were just laundry baskets. Clean laundry at least. I would just every single time. I just would put that baby in the bed with me because we both slept good together than they did over in their crib. Then I had to get up and go and pick them up. And his parenting was so tiring. It was so exhausting. So I co-slept a lot. Oh, mm. Okay. Car seats and travel tips. Car rides are considered safe for your infants, but many parents become frustrated with car seat installation. I strongly encourage going by a fire station, fire station. That's right, fire department, and or even your local health department, and ask for support with installing your car seat if you have any concerns. One of my techniques was I would push. I used my knee, and this was a technique that I learned from working in the health department, working for WIC as a peer counselor within the Clayton County Health Department. One of the techniques that we learned to support families with installing car seats is once you place the car seat into the car, um, especially if you're able to try to press your knee into it to see if you could push it down in there. Because once the car seat is secured in the car, it should not be able to move. You should not be able to lean it from side to side or jiggle it even. It should be very, very secure and tight. Um, so sources recommend either using the seat belt or anchors, not both. Using the side seats rather than the middle. Always pick a place where the fit is the tightest and position your infant snugly in the seat. Okay, just some takeaways for you with the car seat. But again, if you have any concerns about it, swing by your health department or fire station. I would call first. Nowadays, things change so often. Call your local fire department and or your local health department and see if they'll provide that service, car seat installation. Okay. Newborn warning signs. So jaundice. Jaundice is very common in newborns. It is the yellow color seen on the skin of many newborn babies, and it's caused by that bilirubin. So as you're especially for newborns, about 80% of newborns experience some type of physiological jaundice, and that's due to them breaking down what we're told is them breaking down excess red blood cells, and the byproduct of that breakdown is the bilirubin. And so breastfeeding or even formula feeding, either one, hydrating your baby really helps them to flush out excess bilirubin in their bodies to minimize the jaundice. Also, sunlight, exposing your baby to sunlight. I always tell my families to treat your baby like a houseplant. Every day, open the curtains, open the blinds, make certain that your baby is receiving some contact with sunshine every day. And that will help to minimize the bilirubin because that ultraviolet lights will help them also break it down in their skin and they will pee and poop out the excess bilirubin. Now, jaundice becomes a problem when you start to see it in the eyes. Um, if the cornea, if the whites of the eyes are looking yellow, as they're showing you in this picture, you can kind of see in this baby's nose, in the face, you can kind of see this yellowish hue that's building up. The test that I tell my parents is you want to do the press test, and that's where you press from chin, and then nose. And so for newborn babies, you want to do that every day for about 2 weeks, right? Press the chest, press the chin, press the nose, and you're paying attention to that undertone and how yellow does it look. And then also looking in the eyes to see the bilirubin. A simple case of bilirubin can be addressed by, again, sunlight, extra hydration, and even including, if you're not allergic to it, dandelion. If you're breastfeeding, only if you're breastfeeding, dandelion tea. Dandelion actually helps to target your liver. It helps to restore the integrity of the liver. It helps your body to push out uh, excess hormones and things like that and toxins. And so the same is true for your newborn. So if you're breastfeeding, you're sharing that with them. Dandelion is safe. Most ragweed plants are safe for breastfeeding. And you're talking about things like chamomile, peppermint, the ones you find in the grocery store, spearmint, echinacea. All of these are like ragweed type of herbs. Dandelion is another one. So pregnancy and breastfeeding, a lot of times those herbs are safe when taken in moderation. And so that's, as a community midwife, that's one of my go-to recommendations when we start to see jaundice build up. Another one, a sign of concern, is if the soft spot, the anterior fontanelle, the soft spot in the baby's head, feels sunken in or depressed, right? That's a sign of dehydration. So newborn babies, when they're very hydrated, that soft spot feels very soft and supple and fluffy, right? But when they're dehydrated, it's just the opposite. It kind of sinks in. So if you have yellowing in the eyes, sunken fontanelles, we want to go into a pediatrician. Really, if you see yellowing in the eyes, you want to bring them to a pediatrician anyway. But these are just some warning signs that you can pay attention to. Again, the bowel movements. If we see yellow, we got sunken fontanelles, and we don't have bowel movements, definitely concerning, because all of these are signs of dehydration. If your baby is peeing, especially if it's a boy, and they're peeing, and you're seeing some what do you call it's called crystallization, like some orange, like it's when you look it up, we call it brick dust in the diaper. But that brick dust is like it's like it's like crystallized, it's blood. It's kind of like bloody crystallized deposits that's in the diaper, and that's another sign of dehydration for your babies. Let me think of another one. And then again, I mentioned the bowel movements and fatigue. If baby is fatigued and not very responsive, very a weak cry, like a yeah, things like that. All of these are signs of concern for your baby, and you definitely want to bring them to a pediatrician. But dehydration, when breastfeeding isn't going well, or we're not feeding with the bottle consistently, all of these can lead to high levels of jaundice in babies, and then can cause problems. There are a couple of types of jaundice that we look at. Physiological jaundice tends to show up around 3 days, 72 hours or so after birth. And then there is what is the other jaundice called? Oh, it's elapsing. It's escaping my mind. But mm, mm. But the other jaundice that is that when you have blood incompatibility between the mom and the baby. Um, I cannot think of the name of it. Wow. But anyway, I encourage you to Google the different types of jaundice. And the other one would show up typically a lot sooner when there's blood incompatibility. You will see that jaundice usually within the first 24 to 48 hours. So that's something to be mindful of. Um, all right. Let's move on. Okay. Newborn warning signs. Um, and we will watch a short video for this one, just because I believe it's a really good tutorial. It's good for every family should understand how to um, address a baby that's either not breathing or not or that's choking, right? So we want to know just some basic skills. And I encourage you, if you at some point in your parenting, to take a newborn or a infant CPR class, not necessarily newborn. Those are quite expensive neonatal resuscitation classes, but a infant a infant CPR class, child CPR class is worth understanding the techniques of how to do it properly when you're dealing with your own children or just even as a grandparent. And it's good to if you've had the class before, take a refresher. It's just really good information to have because you just have it in your back pocket just in case. You never know. So abnormal newborn behavior. I'm gonna read these one at a time. You have sudden difficulty in baby sucking at the breast or bottle, bluish, purplish, or gray lips, tongue, or face. Around baby's lips appears discolored, purplish, or bluish. Irregular breathing pattern, fast breathing, wheezing, grunting, raspy, gurgly, or whistling sounds. Weak or absent cry. Baby appears to be fatigued or lethargic. I mentioned that earlier. And baby is non-responsive. So if we see any of these things, I always say call 911 because babies can decline very rapidly. All right, let's take a peek at this
Before you
video.
begin, you want to survey the scene.
We're going to fast forward this sister till she gets to her newborn babies all the way at like 16 minutes. Not newborn again, baby. I keep saying newborn. All right.
Set up, and same as with the adults and with the children, we're going to make sure our scene is safe. So we're going to look left and look right, make sure that there's nothing that's going to injure us. If there is an unsafe scene, if you can pick the baby up and take them with you, by all means do so. But your job is to make sure that you are safe also. And now that we have an infant here, the way that I check for responsiveness is I actually tap on their foot, which is their more sensitive area. So I'm going to tap on this baby's foot. If there is no response, I'm going to go ahead and call 911 from my cell phone. If there is a person nearby who can help me, I can point to them and say, hey, you call 911 and come back. And 911 is going to say, what's the emergency? You're going to say, hey, there is a baby who's not responsive, and they're going to ask, are they breathing? Do they have a pulse? And so you can look for chest rise and fall on the baby. You can also, in the baby's inner aspect of their arm, if you take your index and your middle finger, you can feel for the brachial pulse. We don't feel for a carotid pulse or neck pulse in infants because they usually have larger heads and little necks. So it's going to be harder to determine if they have a carotid pulse. But here, brachial pulse, there is no breathing, there is no pulse. You can then, if you haven't called for the AED, go ahead and call for the AED also. If you have the Preston mannequins, they have a feedback device, and you just want to activate it by turning a little blue button on. You're going to press it. That's on their diaper area. You can do infant compression one of two ways. You can use your 2 fingers, or if you find that hard because maybe you have arthritis, you can do the 2 thumb encircling hand technique. And I'll show you both techniques right now. The hand placement, we're going to go in the center of the sternum, the lower half, but not on their stomach. I'm going to do 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. For an infant, you'd be compressing 1.5 inches or still 1/3 the side view of the chest, allowing for full chest recoil. And you would still be performing at least 100 up to 120 compressions per minute. If you have your pocket mask in your one-way valve, if you remember from the previous video that the angled portion goes towards the bridge of the baby's nose, we're going to do our head tilt chin lift, and we're going to give a breath. All right, I gave my 2 breaths, and now for my other technique that is also allowable, I'm going to go ahead and do the 2 thumb encircling hand technique. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'm going to administer those 2 breaths. Press, tilt, And I would continue doing this until help arrives. And my help just arrived with the AED. If you recall from the previous video, we're going to power it on.
Apply pads to patient's bare chest.
We're going to listen to the prompts.
Next to flashing light.
We have the smaller pediatric pads, but if we try to place them according to the pad images,
apply pads, plug in connector.
The pads are going to touch, and that is not allowable. So we're going to place one pad.
Apply pads, plug in connector.
To the center front of the baby's chest. And the second pad.
Apply pads, insert connector firmly.
I'm now going to insert the connector.
Analyzing heart rhythm.
Make sure no one is touching the baby.
Do not touch the patient.
Everyone stand clear.
Shock advised. Charging. Stay clear of patient.
Everyone remain clear, don't touch.
Deliver shock now. Press the orange button now.
I'm going to press the button that's flashing. Make sure you don't touch the infant while you're pressing this button.
Shock delivered.
I go right back into my chest
Begin
compressions.
CPR.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. And you would continue 30 compressions followed by 2 breaths until more help arrives, until you're exhausted. If the scene becomes unsafe, and again, you can take the baby with you, please do so. And if you're in the hospital, then of course you have your rapid response team, or those advanced professionals who can take over. For classroom purposes only, I'm turning off this AED because I don't want to talk over it. But again, in the real world, you would keep this AED on. It's going to reanalyze every 2 minutes, and you would do that until the baby actually reaches final destination. And so again, if you're in a child care center, that could actually be whenever the paramedics arrive and they place their AED on. If you have any further questions, my name is Eunice Mathis. I would love to be your instructor. I'm here in Jacksonville, Florida. Our website is FLisinFloridatraining.com. You can leave a comment.
Okay, so just a couple of takeaways from here because I know that's that can be alarming to think about. But a couple of takeaways here, I think, that is not mentioned is how sensitive the baby's rib cage is. So this particular model they use, you can hear the clicking. Of course, you're not going to hear that clicking in your baby or in a baby that you're trying to resuscitate. If you hear it clicking, that's because you've cracked a rib. So let's be very mindful of how gentle, how fragile their rib cage is. So you want to, if you're in a position where you have to do these compressions, I like the 2 fingers technique that she was using. And you, like she said, you can always also use the 2 thumbs, or you could use the 2 fingers. I like those techniques. And you're only going to do very gentle compressions, right? Just enough to feel the chest go down. And I always like to suggest, if you're ever in a situation where you have to do any kind of resuscitation, you think your baby's choking and the baby's, clearly breathing, but making choking sounds, the first thing you need to do as the caregiver is breathe. You need to breathe yourself. Bring the energy down because you can cause harm with adrenaline. So you have to bring that adrenaline down to a manageable space for yourself so that you can think clearly and so that you can respond clearly. So the first thing you do is breathe. And then you address the situation, right? And so if you're dealing with a baby that is choking, right, there's a whole different way of doing that where you can lean the baby forward and you do these back pats, and you kind of be hitting the baby on the back going upwards, and you're doing that in an upward type of motion, right? And There's a whole nother video that we could play on that one. We won't do that one today though. But that's one way that you can help the baby release whatever is in their mouths. But if you're dealing with a baby that's not that needs chest compressions, you're gonna do that like either with your fingers this way or either with the two fingers this way. And again, you're only gonna indent just enough to see the chest go inward, just enough to push the chest inward, right? Just enough to push the chest inward. That's all we're doing, just nice and gently. And then even with breathing, you can actually blow out one of the baby's lungs. That's another takeaway I think that she should mention in this video. When you tilt the baby's head backwards and you're doing those breaths in their mouth, and you would most likely have your mouth directly on their mouths. You won't typically, most parents don't keep this device at home, and it's your baby. So you're going to put your mouth directly over their mouth. You tilt the head backwards to open up the air passageway, and that's anyone that you're giving mouth to mouth to. You always have to do the chin tilt to lift the head backwards, and you breathe gently. These are gentle breaths. You're not, you will blow out a lung. You can do more harm with adrenaline. Okay, so these are gentle breaths, just enough to see their little chest rise. And this is why taking a class would be very helpful, because you have a better understanding of what I'm telling you now, right? You have a much better interpretation of how to administer newborn or infant CPR, because these little tips are very important, so that you, again, don't cause more harm and that you can be effective in your technique. Okay, I believe that brings us to the end. Yes, it does. Thank you for joining us today for the newborn care. I can't remember the title of the class. My little brain is tired. But for our newborn care class, thank you so much for joining us. And you enjoy the rest of your weekend.
Hi, I'm Miss P. I want to introduce you to PIC'L. No, not this. I'm referring to the Pregnancy Information Circle and Learning Childbirth Education Series taught by community doulas. Come learn with me about pregnancy, birth, and beyond, one bite at a time.